being recorded.
Good morning, everyone, and thank you for joining us today for the meeting of the New York City Health and Hospital Audit Committee. Today is July 16th, 2024, and the meeting is now called to order. I'd like to propose a motion to adopt the minutes of the Audit Committee meeting held on May 6, 2024. May I have a second?
Second.
All in favor?
Aye.
The motion is approved. I would like now to propose a motion to convene an executive session to discuss confidential and privileged matters. May I have a second?
Second.
All those in favor?
Aye.
Aye. The motion's approved. All right. Those invited to the executive session proceed to the adjacent boardroom.
you guys at all.
Together.
Get the vote.
Although everybody.
Yeah.
It's just the process.
To get myself
So we're
together.
covering some the compliance work plan, internal audit.
So do you want me to?
You can.
Oh, it's up to you guys.
Yeah, because I don't have much time.
Okay, I'll do just 1 minute.
I know. We have a good, it's okay. So he says that we can leave.
If you want to, if you hang around, you can maybe
Oh, okay.
see Sally, speak to her. It's up to you.
How long do we have?
Okay. In case anyone was wondering what we did during executive session, the committee reviewed and approved the fiscal year 2025 compliance work plan, and the committee also reviewed and approved the fiscal year 2025 internal audit plan. Now we're going to have a presentation of the 2024 annual audit planning process by David Guzman and Maria Tiso.
Good morning. So I'm pleased to report that we've completed the onboarding process to have KPMG become our new independent auditors. This included the completion of KPMG's independence review and execution of the engagement letter. I'm pleased to introduce Maria Tiso, lead partner from KPMG, so that she could introduce herself and her team members.
So good morning, everybody. Could everybody hear me?
Yes.
Okay.
Yes.
So my name is Maria Tiso. I do know. Hi, Mitch.
Nice
How
to
are
see
you?
again.
So I'm Maria Tiso. I will be the lead audit partner on the audit for the 6/30/24 audit. Just to give some background, I've been with KPMG for 34 years. I've spent my entire career working on health systems, and I've done multiple rotations on the audit of Health and Hospital Corporation throughout my career. So we're very thrilled to be back to working with you and your team. So we're thrilled to be doing that. I do also wear different roles at KPMG. I'm also the Northeast Commercial Healthcare and Not-for-Profit leader for the Metro New York practice, also for Boston, Hartford, Short Hills, Long Island, Albany. So I do that. I'm also the healthcare industry leader, and also I am the co-leader of our KPMG Network of Women, which is one of our 7 diversity groups. So I've been doing that for quite a bit of time. Joining me today is Camille Fremont. Will be one of our supporting partners, and Ryan Santanacita, who's a managing director. So the 3 of us have worked together for over 20 years, and they've also worked on H&H in different roles also. So we do know James. So again, we're thrilled to be here working with you guys again. So going to the next page, on page 2, this slide talks about how we will be delivering a better audit experience. So we do that in 4 ways. The first one is our number 1 priority is to make sure that we're providing an audit quality audit. That's making sure that we are addressing all the professional standards, making sure we're addressing all of the government standards and accounting standards. Second way is to make sure that our team members have healthcare experience, but also government experience. We want to make sure the team is effective, efficient, and that when we're working with James, Dave, and his team, that the individuals are knowledgeable of the organization. Third way is to make sure that our audit is efficient and effective, making sure that we're productive. We can talk a little bit about that later. And then one of the other thing is to bring to management and the board and the audit committee some industry insights as we get them from both a local and national perspective. What I do plan on doing is inviting our national healthcare partner, Ash Yada. He's on the client service team. He will come probably when we talk about our required communications at the end of the audit. He can talk about what he's seeing at other organizations and talk about healthcare issues that you may be interested in hearing. So Sally, I'll introduce you to him at some point too. I think he's a good person, and Mitch too, to really just be connected to.
That's a great perspective to provide.
Yeah,
Thank you.
exactly. So, and we'll work with Dave and James to figure out the right time to bring him. But I would think maybe when we come in October, we can have him come and talk about that when we're doing our year-end audit results.
Terrific.
Okay. The next page is the key themes that we're going to be talking about. We'll talk about, the software tool that we use. as it relates to our audit documentation. We'll go through the scope of the audit, we'll go through our required communications, and then we'll go through the timing and our audit plan. This next page, which says an audit aligned to you, pretty much what this page discusses is our software audit documentation tool. It's called KPMG Clara. It's the audit documentation tool that we've been using for several years. What's great about it is that it encompasses data and analytic tools that really help us do the audit with efficiency and ease, and also, identify anomalies. Before we used to do a sampling, we used to pick 20 samples. If those samples were right, we would move on. But this really gives us the tool to almost look at 100% of sometimes a population and take a look at some of the, higher risk anomalies to see how we can actually provide insights to the management team and benchmark and things. It's not just looking for errors, but also some, value add opportunities in certain areas that we'll be auditing.
Terrific.
This slide talks about, how we drive audit quality, and, one of the things, there's a lot of things on this page. Really, it's about, communicating with the team on an ongoing basis. If there's new transactions, questions about accounting standards, making sure that we're plugged in, year round. It's not just, when we come in to do an audit. We really want to make sure that we are avoiding any surprises, any last minute, audit adjustments. So we'll make sure the team's plugged in with James and Dave year round. And we also started to do that as well. And then the next page, this page are the deliverables that we'll be issuing as part of our audit. These deliverables are consistent to what was laid out in the RFP. And so this is what we'll be working on this year. Okay. And then the next page is a snapshot of our client service team. Again, the top page, you'll see myself, Camille, and Ryan. That will be the core audit team, but we also have two senior managers, Yimiao Chen and Chris Dominiani. Chris will be working on the cost reports, and then below that we have various other managers and senior associates and associates. Over to the right, we have an account executive, Jane Letts. We also have Steve Reeder, who's our engagement quality control reviewer. So every financial statement and report that goes out always gets another second pair of eyes to look at to make sure that there was nothing missing. So Steve has significant healthcare and government experience. So he will take a read of the financial statements and any other report that goes out as almost like a second pair of eyes. And then we also have a Metro Plus team. Jocelyn Danowski is the partner, and Eric Crossett is the senior manager. Again, they'll be working on that, but they will be reporting to me, and I will make sure that I am, involved in any issues or anything that's happening as it relates to that organization. And then over to the left, as I mentioned before, a national sector leader, Ash Yada. He does come to a lot of audit committees around the country, and again, I will introduce you to him in October. We have a tax principal, Felicia Tucker. And then our team is also made up of subject matter professionals, more specifically in the retirement benefits and claims payable. So they will be assisting us as we review those areas. And then we also have a minority business enterprise, the Avaloria team that we'll be using as part of the audit. With that, I will turn it over to Camille to go through the next few slides.
Great, thank you. Good morning, everyone. Again, thank you for having us. Very excited to be here. Hopefully, as we go through this, if there's any questions, please feel free to ask us. As a reminder, we will conduct the audit in accordance with auditing standards generally accepted in the United States of America, as well as government auditing standards. And throughout the audit, we're going to get an understanding of your internal control over financial reporting to allow us to design audit procedures that are appropriate in the circumstances. But we will not be expressing an opinion on the effectiveness of the internal controls over financial reporting. That would be something you would more likely see in a SOX audit or a public company audit, so we're not issuing that second opinion. As we turn the page, we do use professional judgment in determining materiality in the context of the audit. We will consider such things as quantitative and qualitative factors to make sure when we're looking at audit areas, we're thinking of the users of the financial statements and what would be relevant to them. Turning to slide 11, we've laid out the timeline for you. As David noted, we've gone through our onboarding and independence procedures. We have reviewed predecessor auditor work papers. We are here today to communicate the audit plan. We've had different conversations with James and David, which will continue on throughout July as we go through our risk assessment procedures and make sure we have a good understanding of processes so that we can design our audit procedures appropriately. This year, we're going to do all of our test work in the July through October timeframe. So that will include any of our planning procedures, our substantive audit procedures. We will ultimately review the financial statements that have been prepared by management, and we'll talk through what those disclosures look like, ultimately culminating in us coming to present our audit results in that October timeframe that Maria described before. And there we will issue our audit opinion. We know that there is a mid-October deadline so that these financial statements can be included within the city. And then after we get through that October timeframe, we will change our direction through November through May to go through the other deliverables that are required. So that will include the Metro Plus health plan, the ACO, as well as the insurance company. And we will stand ready to perform the cost report audits once the state releases the appropriate software for those reports. So with that, unless there's any questions, I'm going to turn it over to Ryan to start through some of our risk assessment procedures.
Thanks, Camille. And so our initial preliminary risk assessment, we have identified a significant risk of management override of controls. Management is in a unique position to perpetrate fraud because of its ability to manipulate accounting records and prepare fraudulent financial statements by otherwise overriding controls that appear to be operating effectively. Although the risk of management override will vary from entity to entity, it is present in all entities nonetheless.
Sorry, right, that you're just stating that as a general, this is not something you
Yes.
find.
Yeah, no, exactly.
This is not
We're
a
not
specific
starting
case.
with this.
Haven't begun yet.
So management override of controls is a significant risk for any
Every
organization that's
organization,
audited,
right.
yes.
Got it, just wanted to clarify that.
Yes.
Moving on
And
to the next slide. This gets a little bit more
mention,
specific.
just because we talked about, as several board members saw in the newspaper, that at Downstate, there was a $1.4 million absconding of money, which was done by the head of an emergency department, another government institution. And I think that it was by, mislabeling.
Yep.
So exactly the sorts of things that you're talking about, someone at the top of the food chain being able to somehow charge to the taxpayers, doggy daycare without anybody, noticing.
Right.
And one of the robust procedures we do over that area is a reviewing of journal entries. And so we make sure that, we're looking at, high-risk journal entries, really focusing on a significant amount of that population to see if there's any anomalies like that, like looking at descriptions, looking at, were journal entries posted on the weekend, were, certain members that are not supposed to post journal entries, posting journal. So there's a whole bunch of criteria that we look at when we're going through this area here to see if there's any unusual anomalies.
Right, and I would just add to what Maria is saying in terms of journal entry test work, we will also read through the internal audit reports that have been done throughout the corporation, understand perhaps what is, filtering up to the top based on those to make sure that, again, we're not just thinking about quantitatively significant areas and quantitatively significant amounts, but also understanding the organization and making sure we address those. Also thinking about, and we'll be speaking to the compliance officer to understand what's going on there, and that all helps us to formulate how we will respond.
Thank you.
Okay.
Moving on to the next slide is the additional risk assessment for some additional considerations. Initially, we have determined that we have elevated or increased risk related to the valuation of patient accounts receivable, the valuation of claims payable liability, the valuation of pension and post-retirement obligation. Additionally, we have other key audit areas on the left side of the screen where we'll perform either audit or risk assessment procedures. Some of those areas include due to and due from third-party payers, premium revenue and receivables, grant revenue and receivables, lease liabilities, as well as appropriations, and then long-term debt and debt compliance. If any of our initial risk assessments change during our audit procedures, we will provide an update to the committee at year end.
Ryan, you didn't mention the information technology. Does this capture things like cyber risks or anything
Yes,
like
so as part of our audit procedures, we will obtain a general understanding of the IT systems, the overarching cybersecurity program, and then any reports that system generated reports, we do need to test in accordance with the standards. So if we obtain journal entries from the PeopleSoft system, then we will have to test the system or test a certain number of journal entries from that system based on the risk profile associated with that. Whatever that number may be.
And then as it pertains to cybersecurity, as Ryan is discussing, we will ask questions, understand, have there been cybersecurity incidents? Are there cybersecurity
change.
insurance policies? Is
exactly,
there training?
yep.
All of that to understand, but we're not doing an audit specifically over cybersecurity. If there is an incident, we'd have to understand it, and then we would take the next steps depending upon what it impacts and how.
Right, so if there is an incident, I mean, our responsibility is to see if there's any financial statement, impact, as well as any potential disclosures to the financial statement. So, as part of the audit, we would definitely, talk to see if there would be any impacts to that.
Have you guys been doing completed audits yet that have incorporated the Change Healthcare?
Yes.
So how would that manifest in your work?
Yeah, so a lot of organizations that I've audited, Change Healthcare really did not. We would have to look at the materiality of the impact to the Change Healthcare. So we'd have to obviously have a discussion with the management team to see, what protocols they put in place, and typically a lot of organizations have received their cash, currently. So it all depends on the facts and circumstances of the organization. So we'll definitely make sure that we're talking to the management team and see the impact of that to the organization. Okay.
Thank you.
Okay.
Covering the involvement of others, as Camille had mentioned earlier, we will review the internal audit reports and assess the impact on our planned audit approach and establish a level of coordination between KPMG and the internal audit department. Additionally, KPMG will utilize professionals with specialized knowledge, specifically to assist in the areas of pension, post-retirement benefits, and the claims payable liability. This slide will cover the newly effective accounting standards, and for 2024, GASB 100, which is related to the accounting changes and error corrections, will be adopted by the corporation. You'll see GASB 100 through 103 are effective for years 2025 and beyond. In the year of adoption, we'll cover the impact for the audit committee at that time. Moving on to the next page, this is just a high-level summary of the GASB 100 changes. This statement will improve the clarity of the accounting change or error, which will improve consistency of application. This will stand to enhance the consistency in the disclosure requirements about if there were to be a change in accounting error or a change in accounting principle. Moving on to the next slide, which is shared responsibilities and independence. As Maria had mentioned, as part of our onboarding process, we did complete a robust independence review. However, that independence process is an ongoing process throughout the time that KPMG is involved, will be your auditors. It is a shared responsibility between management, those charged with governance, and KPMG itself, with each group playing a pivotal role. In order for KPMG to fulfill its professional responsibility, we have a system of quality controls to ensure that we maintain compliance with independence rules and firm policies. Timely information is necessary for business changes such as new transactions or new affiliates. Additionally, certain relationships are prohibited under independence rules relating to employment relationships and business relationships. KPMG system of quality control has a repository in which any new type of relationship or work would be submitted into our system and reviewed by Maria Tiso. In addition, we have an independence team group that will also assist in the review to ensure compliance with independence rules.
And as you know, we've done a thorough independence review before we were engaged as your auditors. So, as I said, as the lead audit partner, that responsibility lays with me. So any type of advisory work that some of our consultants may respond to RFP, it all has to come to me first before anything could be moved further with that.
Very good.
Okay.
The next slide outlays responsibilities of management, as well as KPMG's responsibilities related to objectives and other management responsibility. The audit of the financial statements does not relieve management or those charged with governance of their responsibilities, and they're required to communicate with governance. Additionally, KPMG's responsibilities related to objectives. We're required to promote effective two-way communication between the auditor and those charged with governance, communicate effectively with management and third parties, and provide those charged with governance timely observations from the audit that are significant and relevant to their responsibility. Additionally, KPMG is responsible for forming and expressing an opinion about whether the financial statements are free of material misstatement, and establish an overall audit strategy, audit plan, which will outline the nature and timing and extent of the procedures necessary to obtain sufficient audit evidence. And we're responsible to communicate any procedures performed relating to information of the results of those procedures. Lastly, moving on to the next slide, which was inquiries. Throughout our audit process, we will hold conversations with those charged with governance, as well as various members of management, whether it's the CEO, CFO, head of internal audit, compliance, and then as well as those charged with governance. Here is an outline of some of the questions that are asked during those process. If any matters arise, during that come to either the board's attention or management's attention, please feel free to reach out to myself, Maria, or Camille if something comes to your attention.
And what we'll do is when we come back in October, we'll put this slide again in the presentation deck just to remind everybody these are some of the questions. And if there's anything that came to your attention, in the next several months, to definitely reach out to me. Okay. So that concludes our audit plan presentation. Does any questions at this point?
Confirmed that you were able to access the work papers for last year's audit?
Yes. So we arranged to do that. It was 2 weeks ago that we reviewed the Grant Thornton work papers. We still have to work through the Metro Plus work papers. They're still working on giving us access. But for the corporate audit, we've done that whole review already.
Right, thank you. Thank you for a very comprehensive presentation.
Great, thank you. And we're looking forward to working with everybody.
Giving us, just the presentation gives a lot of confidence.
Great, thank you.
Okay, we don't need to take any action on this.
No action.
No. And now we're going to have an internal audit update from Joseph O'Keefe.
The first items we have are the external audits that are going on currently within the system. The first one is language access. I'm sorry, I'm out of order here. The first one's the mental health services for inmates. This one is going ahead in a very slow manner, I should say. They're working on it at this point. There's been a lot of different issues over access to information, patient or prisoner patient information, things like that, which they're now getting straightened out, which will allow the pace of the audit to pick up a little bit.
Sorry, this audit is being done by control.
That's the city comptroller's office.
Comptroller, okay. Oh yeah, I see, conference held. Thank you.
The second one is language access, which is being done by the state comptroller's office.
Okay.
This one has been moving along fairly quickly. It's been taking a while, but we do have an update meeting this afternoon with them to see the status of the audit and what else they're expecting from us. The third audit is...
Sorry, are they in touch with the folks that do the language services?
Yes, they are. Actually, the access people are actually here today. I know it's outside in the audit, but yes, they have direct access with them. Well, it actually goes through me, but they do have access to the language access people.
Okay.
The third one is the Be Heard program, behavioral health assistance response. It's another audit that's going over, but it was another one that had issues over access to information, mental health records and such. So they are moving ahead with that audit. In the next item is internal audit activities. We had 14 audits on the plan, 6 are completed, 7 are in progress. 1 is actually going to be pushed to the next year. The last item is the auxiliary audits and the update on the audits that are auxiliaries that are done by the Bonadeo Group. We are slowly but surely phasing out these audits, or completing these audits will then phase out our involvement in this process. The auxiliaries will have the audits done independently from us. And that's the last item, if anybody has any questions.
Just a quick question on behavioral health audit. Is there focus really on the issue of access to mental health? Is that what they're focusing on?
Which, the Be Heard program?
No, not to be heard, the
first one
mental
is
health
the
services,
correctional health and the
inmates.
access to, right, it's
Correctional.
prisoners' access to mental health. And are we providing the necessary services? They're looking at the initial evaluation, both medical and their mental health evaluation that's done going in. So they're really looking at the whole process, how services are provided inpatient, are patients segregated, things like that. It's a rather extensive audit that they're doing, looking at all these. They look at the individual patient to see, are we actually providing the services that we determine are necessary for the patient? What do we do if the prisoner or the patient refuses to leave their cell? Things like that, like different issues, and how do we handle all of those issues? They're also looking at our ability to hire people to work in this program. And are we able to keep the people, or do we have qualified counselors such that are working in this area, and individuals within it?
But names are something that are off the table in terms of what they can access. So,
They're not, that was the biggest sticking point, is how we would give them the information without them being able to identify who that patient was, which is difficult for the prisoners, because even if you say, we started this service on this date at this location, that would take it down to like 10 people that, or whoever were arrested and provided services in that area. So we had to make sure you couldn't backtrack into finding out who that patient was. So it has made it a rather lengthy process that legal's been involved with them to make sure that we provide them information, but they cannot identify who the actual patient is.
very interesting.
Hadn't thought about that.
Okay, let's see. Okay, and thank you, Joe. Now we're going to move on to the compliance update by Kathleen Hopsels.
Good morning, everyone. We go to the first slide here. These are some updates on what the Office of Corporate Compliance has been doing since our last meeting. We have completed the fiscal year 2025 risk assessment. As previously stated, the OCC and internal audits did a combined risk assessment and presented that to the Enterprise Risk and Compliance Committee in February. They reviewed it more in April and discussed it further. Then on June 21st, the ERCC approved the risk assessment, and the compliance risks from that risk assessment have been incorporated into the fiscal year 2025 corporate compliance work plan, which was presented to the audit committee today. Moving on, our coal fire risk 2024 risk analysis. They do the HIPAA risk analysis every year, and they have done the documentation collection, interviews, and site visits for the skilled nursing facilities and the acute care facilities. And we are reviewing the workbooks that they presented based on their reviews for those facilities. And the document collection, interviews, and site visits for the diagnostic and treatment centers and neighborhood health clinics have also been completed, and they have presented us with workbooks from other findings from those facilities. And in relation to that, we have recently posted an RFP for continued HIPAA risk analysis and security assessment services because Coal Fire's contract is ending on December 31st of this year. On June 11th, the Contract Review Committee approved our request to issue an RFP for a new vendor and for services for 3 years with 2 one-year options to renew. It was sent to existing vendors, known vendors, as well as being posted on City Register on June 28th. We've also received questions from some of the vendors that we are responding to this week.
And the coal fire contract, how much did we end up spending for coal fire?
That was approximately $3.5 million over 3 years.
$500,000. That's a very low amount of money for an awful lot of work.
Yes, so it's going to be, the budget's increased this year because previously we did not do the option, the 2 one-year options, and we're
Right.
doing that this year. So, because it is a lot of work, and it is good to have the continuity. We have had coal fire for the past 6 years. They won the bid the second time around, so there has been also a great deal of continuity. They are bidding again this year as well.
Terrific.
Moving on to more of our activities, we have completed our general compliance training module and expect the enrollment to occur hopefully next week. The compliance training module is split into 2 sections. One focuses on fraud, waste, and abuse, and the other focuses on code of conduct. We did this because the Office of the Medicaid Inspector General has expanded the compliance training topics that would need to be provided. So we didn't want to inundate someone with an hour or plus in one sitting. So we divided them into 2 separate sessions. Since we last met, we appointed a new corporate records management officer. We are also working on a communications plan to better communicate what the Office of Corporate Compliance is doing to the whole workforce. We'll be doing hot topic emails that are compliance hot topics. We'll be posting compliance FAQs on our intranet page, doing screensavers focused on compliance issues, articles in the Insider, and some infographics that are helpful to educate workforce members on what we do and when they should come to us. There have been some new regulatory rules recently. In February, the Department of Health and Human Services published its final rule in the Federal Register on the confidentiality of substance use disorder patient records. These are revised regulations. It became effective on April 16th, but compliance isn't required until February of 2026. Similarly, on April 26th, the Office for Civil Rights published its final rulemaking on reproductive health care privacy in the Federal Register. Both of these rules will require the Office of Corporate Compliance to revise its Notice of Privacy Practices because to incorporate the new requirements in these rules and possibly changes to our treatment, payment, and healthcare operations form, which is we refer to as our TPO form, which we ask patients to sign so that we can share their information for treatment, payment, and healthcare operations purposes. We will be working with the Office of Legal Affairs to make these changes and, if necessary, revising our HIPAA privacy and security policies and procedures as necessary.
We have an opportunity, it'd be useful to see how the reproductive health care privacy requirement actually rolls out in terms of a more detailed sense of what we're having to do now that we didn't have to do before.
Okay, I can include that in the next report if that would be helpful. And then we have some metrics. So these are the number of cases for the first 2 quarters comparatively from 2022, 23, and 24. It's 22 and 23 were pretty close. 24, we had fewer reports made in our second quarter as compared to our first quarter. And the next one is the privacy report metrics. This is a good thing that we have fewer reports in the second quarter than in the first quarter.
And I think
Yeah.
maybe the graph got duplicated. It's exactly the same as the compliance.
Oh, I'm sorry, you know what? You may be correct. I apologize for that. I will make sure that that gets fixed. I'm sorry.
That's it.
I don't know how that happened, but we didn't catch it in the briefing either, so I apologize. The next slide documents the issue types that we receive. These are how the complaints or reports are categorized, and the issue type for the non-privacy cases. Let's see, I think that this is something that, because this is not the same one that I have, but this is the biggest one that we get are the patient care, patient rights. And part of that is likely due because the Office of Medicaid Inspector General requires that we post our helpline and a way of communicating to the Office of Corporate Compliance at a location where Medicaid recipients can see it and can access the helpline, so it's posted on our website. So we do receive complaints or issues raised by patients themselves. And the reporting source, this is how we are contacted. As you can see, the big ones are the email directly to us. That's our, we have a compliance at nychhc.org mailbox that anyone can submit a report to. And then the next highest one is our helpline, which is the one where we have a vendor that monitors that and takes the calls, and that is a way for people to make anonymous reports.
Okay. And on the patient care and patient rights, do we have subcategories for that in terms of how they break?
Sometimes they do, but they don't make it to we haven't made them into this metrics.
Okay.
But oftentimes they don't document a sub issue. It's just patient care, patient rights. But it's something we can see if we can't categorize more specifically.
Yeah, it would be interesting if we can get a better feel for what.
Right, sure.
Catherine, is this pretty consistent with like historical categorization of?
Well, the patient care, patient rights, I think is greater now because of the of posting our helpline on our website. It didn't used to be as big as that. The others are relatively consistent with prior years, though.
Right.
Okay.
Any
Thank
questions?
you very much, Catherine. Any questions? Okay. Hearing no questions, are there any questions about anything we've covered so far? All right. Hearing none, is there any old business, new business to be conducted? If not, the meeting's adjourned. Thank you very much.
Thank you.
Thank you, everybody.
This meeting is no longer being recorded.